This is the last kind of formal session for the day. We're going to zip through just a summary of some of the things that we talked about today to try to drive some of these points home. And then Nick and I will be around to answer some questions, either in a group setting or one-on-one for a little bit. The residency fair starts in just about an hour, and I think some of us need to run to set up for that. But we'll provide a little bit more time here. Can you hand me that? First and foremost, I appreciate you guys' patience with us today. I know there were a couple changes in the schedule, but I hope that this was a valuable session. I'd like to encourage you, and we're even going to give you just a few minutes to fill out an evaluation. So Nick and I will be putting this on next year. We want to know what you guys liked, what you didn't like, what was valuable, and what changes we could make. So if you guys have the SAEM app on your phone, if you just go to the Medical Student Symposium, go to the bottom there and hit evaluation. There's a bunch of questions. Do as much as you can. We really, really value your feedback. I'm going to actually give you guys like 5 minutes to access your phones and submit some evals, because I can't tell you how important this is to us to understand how to do this better next year. And then we'll quickly run through, like I said, some of the highlights from the day. For people who are hard at work completing evaluations, Nick's going to walk around and pass out some VIP passes to the party tonight. So either fill out an eval or look like you're filling out an eval. You might get lucky. Okay, guys, thank you very much. Sorry to force you to do that, but otherwise we don't get evals and we can't make decisions and make this better going forward. So let's spend just a few minutes talking about some of the highlights of the day. This is the promise I made you 6 hours ago, right? We were going to get you from the volcano to the secret garden, playing with dolphins, the residency of your dreams. And so I hope that we did that. I hope we mapped out some of this process and how all these acronyms and steps in the way contribute to getting you to be the best applicant you can be. So just a couple summaries from some of the talks. Dr. Kass, remember, mentorship is really driven by the mentee, so you as a mentee have to take some ownership. Do your research, make sure you know about the person you're approaching for advice, and have a specific ask rather than just, hey, I need help, right? Ask them for something specific that they can do for you. Career options, I think we had a really robust discussion about a lot of different options. Remember to just follow your interest and see where it goes. And the nice thing about emergency medicine is there are a lot of doors that are open to us to explore a lot of different things. Some of the things that Dr. Hiller talked about in terms of options for emergency medicine residencies, location becomes very important, right? This is going to be a place where you spend a lot of your time, and it needs to be something that somewhere where you're happy and where potentially you could have future career prospects. Understanding where you fall on the 3 versus 4 year spectrum. It's a hotly contested debate. Everyone you ask is going to tell you that the way they trained is the right way, but thinking about what you feel like you need. We talked at our table that you hear this a lot, that emergency medicine probably should be 3.5 years. So are you that kind of person who is okay being a little light on your training, or are you somebody who wants to be a little heavy on your training? And there are differences among us, and understand that. Away rotations, Dr. Story talked about you need 1 for sure, 2 for some. I think some of the advice we had at our table was talking about more non-traditional applicants, and that sometimes a second rotation at a site can help strengthen your application. But you got to get true slows from both. And then remember that that's a 4-week interview, right? The whole time you're in that city, you are under a microscope. The slow, Dr. Kulstad walked us through this. I would encourage all of you before you start your rotations to go back and pull up the slow again. Understand, I mean, this is us showing you how you're going to be evaluated. Understand the components that you're going to be graded on, and you should walk in armed with that knowledge. We talked a little bit about clerkship advice. Of course, I stood up here for 20 minutes, and the only thing that made it to Twitter was that I said the word asshole. But remember that advice, right? Don't fall victim to those things that are common pitfalls. Show up on time, work hard, be energetic. Those are the things that we're looking for. Be coachable, be teachable. Dr. Pound gave some great advice on the personal statements, right? Her 4 Ps, prep, pen to paper, proofread, and pitfalls. But really tell a story, and this is your opportunity to address areas in your application which may raise questions or concerns, and really paint the picture of who you are and why you're interested in emergency medicine and where you see yourself. Dr. Gisondi gave some great advice about the EM match, right? Have a strategy, get good advice from the right people, avoid all the noise that's out there that contributes to a lot of the bad advice, and really be honest with yourself and find someone who's willing to be honest with you about how competitive you are and understand how that affects how many applications you need to do, how many interviews you need to do. Drs. Parsons and Mannix talked about ERAS, which really it's just about understanding the deadlines, the components, and being proactive, right? Make sure that, again, you proofread everything, but that you're ahead of schedule on everything. So the moment that that's available to be submitted, you have everything you need to submit. Drs. Franzen and Price talked to us about interviews, right? Lots of great tips in there, but I think one of the things that we talk a lot about, and I know Emra's working hard on this, is understanding the number of interviews, right? So that 12 to 13 number for LCME students is plenty of interviews, right? Above that, you're just stealing interviews from other people, and you're going to match. So don't overdo it. Save your checkbooks. Dr. House talked about the SVI, right? The preparation, that pretty much however you prepare, you're going to come up with about an even score. So it's worth going through some of the steps there, but I wouldn't give it too much of your time. And I love this idea of the CAR format he presented for how you answer these questions, right? Tell a story and have a beginning, middle, and end, right? Reflect on your story at the end to drive home those points you're making. And then lastly, Dr. McGinnis talked about our non-traditional applicants, right? Embrace these things that make you different. Don't run from them, don't hide them. They're not baggage, but explain them and explain how you can fit in. So we've kind of armed you with those skills. Hopefully this was valuable to you. Again, please submit evaluations if you haven't done so already. And we're happy to stick around for a few minutes if there are general questions, or if you want to grab us on our way out the door, we can do that as well. Thank you, guys.